So our next panelist is Edmond Hughes, who's the Vice President of Human Resources and Administration from the Ingalls Shipbuilding. Since 2006, Edmond has led all the aspects of human resources function related to the recruitment, development, and retention of the workforce. He is in charge of the personnel at the on-site medical clinic at Ingalls Shipbuilding, which treats employees for industrial work injuries that are sustained at work. They mentioned that, Dr. Winerty mentioned that at the Texas Medical Center, that they do the same sort of thing. Mr. Hughes is a 2012 graduate of Leadership Mississippi, and please welcome Edmond Hughes.
Well, good afternoon. I think one of the important things from a human resources standpoint is to always let you know one very important thing. At Ingalls Shipbuilding, we are hiring. So if you know individuals who need a job, we are hiring. I'll probably remind you of that remark when I end also. But what I really want to do as the only industry representative is one to tell you I don't assume everyone knows what we do, so I'm going to remind you of that. We are Huntington Ingalls Industries. We were spun off from Northrop Grumman in 2011. The corporation is headquartered in Newport News, Virginia. We have about $6.6 billion in sales with about 37,000 employees. We build ships. Aircraft carriers, submarines are built up in Newport News. Destroyers, Coast Guard cutters, amphibious ships are built here in Mississippi. And again, we are hiring. So from a Ingalls Shipbuilding standpoint, we have about $3 billion in sales, about 15,100 employees. The significant portion of those individuals are located in Pascagoula. We have about 10,000 employees in Pascagoula, but we do have some other locations. We have individuals in Gulfport, New Orleans, a small shipyard that we have responsibility for out in San Diego, and about 2,000 employees who are based out of Virginia Beach, but are spread all over the world wherever the fleet is. So that makes up the Ingalls Shipbuilding organization. But the focus today is on the health and wellness. Now, the remarks that have been made this morning are accurate about what we face as an organization. Why is health and wellness so important? It's a cost of us doing business, and we want a healthy workforce. The work we do at Ingalls Shipbuilding from a craft perspective is physically demanding. If you can imagine, it's 95 degrees. You have on the equipment that you can weld. You're at the bottom of the ship, and it's hot. In the winter, it's cold. Most employees, if you've ever been to the shipyard, have a long walk to get to the shipyard, in and out of work every day. So the work's physically demanding. But we need healthy individuals. All those items listed this morning are exactly the items that we have to deal with from a health and wellness standpoint. High blood pressure, diabetes, obesity, are all those things that impact us. So as an organization, so what are we doing about it and how are we addressing it? So since 2011, we've worked with a company called Health Waves, or Health Solutions, that have assisted us in looking at some of our wellness programs. Now, have we achieved everything we wanted to as an organization? Absolutely not. But are we making progress? I am very, very comfortable and confident we are making progress on a number of these initiatives. So I just wanted to mention a few, and a picture's worth 1,000 words, so I'm going to show you some pictures of some things that we've been doing in our organization. But as Clay mentioned, we do have a full-service occupational clinic that's focused on injuries. So if an employee is injured at work because of the physical demanding nature of what we do, we have a board-certified emergency physician, we have a nurse practitioner, and 4 nurses that are on staff to handle and treat those items. We also have a full-service fire department that responds to issues, and EMTs that help respond to issues. From a physical activity standpoint, this is an area we've made significant progress in. We have a gym at our facility, and I'll show you wonderful pictures of our gym that we're very, very, very proud of. And our employees can participate in this gym for $10 a month. I don't know where you can find those kinds of deals, but we have probably close to 1,000 individuals who belong to that. Governor, we're going to extend an invitation to you to come to our 5K and help Erwin Edenson lead that off. It's September 28th, and we'll make sure you have all that information. But also on a health, education, and stress standpoint, we have an EAP counselor on site. Imagine a site that has 10,000 people and all of the issues that will come up on a daily basis with those 10,000 individuals. So we have a licensed EAP person on site that assists in that area. We also have a full-service cafeteria for our employees, and what's unique about it is, yes, we do serve healthy meals. We've actually kind of rebid the cafeteria items to ensure that you not only had red beans, rice, and sausage, but there's a very large salad bar that's also available. And the vending machines have to have a certain percentage of healthy foods in them. So again, we're trying to work on that prevention side of things to help the organization. So from a medical clinic standpoint, you can imagine with 10,000 people at one site, you have a number of injuries that will occur during the course of a workday. We have probably 31,000 visits to this clinic on an annual basis. But again, full service fire department, 24 hours a day, 7 days a week, and we treat items. Now, I will talk to you as we wrap up about some of the things that we're looking at going forward and items for the future. And many of those things that have been discussed today are what we will be looking at in the future in regards to care for not only employees, but looking at trying to treat them for their personal issues and not just work-related injuries. The Wellness Center. We started the Wellness Center in 2009. We took over a facility that was a formerly part of the naval base and made it the gym for our employees. As you can see in that gym, we have the aerobics, we have weights, we have aerobics classes, Zumba classes, we have racquetball courts, probably one of the few places in the area that has racquetball courts, have racquetball tournaments, fitness challenges. Actually, I was third in the racquetball tournament, very proud of that. This is an item that we're extremely proud of. There were only 2 companies in the state of Mississippi to win the Fit Friendly Award from the American Heart Association. It was Ingalls and one company here in the Jackson area. But you're required to do a number of things to win this award. And if you were ever in our administration building, you'll notice that there are walking signs inside the building. And if you see individuals doing lunch, they're actually walking around. There are 8 laps through the administrative building that equal 1 mile. So people are actually taking that fitness piece seriously. But we won the Fit Friendly Platinum. Now, that's the top award, and we're extremely pleased and proud of that. And like we said, there are a number of things that we do with the gym to focus individuals on that fitness side. Another focus is, again, those lifestyle changes make a big deal. So a lot of our efforts are focused on the wellness activities. One of the current activities through the American Heart Association is called Active for Life. It's a 10-week challenge for fitness activities. So you set your personal goals and objectives. It's a gold, silver, bronze. You determine how many hours a week you want to work out, and you kind of track it. And we've had a number of teams across the organization. Our goal is to increase that each and every year. And this year we've increased the number of individuals who are participating in that. We also do a number of glucose screenings. You have to get some baselines to determine whether or not individuals are getting better. If individuals don't know they have high blood pressure, you can't treat it. So we screen to make sure and find out some of those things for individuals. This will be our second annual 5K on the Causeway. Last year, our first event, we had about 400 individuals to participate. All proceeds from this event go to the Special Olympics. So we were able to write a check to the Special Olympics to help that organization. We believe strongly in giving back to the communities in which we live and work. And so we will hold our second annual event. And if you're on the Mississippi Gulf Coast on September 28th, we would welcome you to participate. Remember, all proceeds go to the Special Olympics, so we invite you to come down. As I said, the work we do is physically demanding. And, oh, by the way, you find that on the Gulf Coast there are several shipyards and people do offshore, so you may come to work for Ingalls, decide for whatever reason, and I don't know why you'd want to do it, but leave Ingalls and at some point come back. Well, if you do that a number of times, we want to make sure that if we hire you in, you can physically do the minimum requirements of the job. And we don't want to hire an individual in who can't meet those requirements. So one of the things that we've started doing is looking at the physical agility and kind of allowing individuals to go through some simulated exercises to ensure that they can climb ladders, carry the materials, do certain things. And so we've put that in place to help look at cost. Again, workers' compensation is a significant cost of us doing business. Now, first and foremost, we want to ensure that our employees are safe. That is our number one priority. But if a person happens to get injured, we want to ensure that they're okay. And so we put things in place to ensure that. And one of the things we want to do is work hardening. Is so if you're injured, kind of go through some physical therapy to ensure you're better and you can get back to work faster. But if we look at the future, what are we looking at as an organization? It was mentioned today, yes, we're looking at telemedicine as one item to help drive down costs. You know, our employees, like many others, use their emergency room rather than going to your primary care physician, and we want to help individuals with that. The other one is looking at using the medical facilities to allow our employees and others to treat their family and other members. And so with that, I want to thank you for the time. I enjoyed the opportunity to present, and that just gives you some idea of how industry is approaching it. Thank you.